Our next speaker in our webinar will be Dr. Terence Scott from the Global Alliance for Rabies Control, and he'll be sharing with us some of their experience in regards to a regional approach towards rabies elimination. Dr. Scott?
Thank you very much, Dr. Ruprecht, and thank you very much to all the organizers for inviting me to present at this webinar. It's also fantastic to see so many familiar faces and names in the participant list. So I'd like to thank everyone for joining us from across the world. I think the agenda for this webinar has been set up perfectly, or at least in line for my talk today. So we started off by looking at the national strategy and the development and implementation of that at the national level, and then moving on to the talk from Andy that we've just heard about the implementation of the work right on the ground, the implementation of the national strategy. But what I'd like to do now is to zoom out a little bit more to see how this all ties together at the regional level, and also then filtering down from the international level to the regional level, and then down to the national, and obviously, hopefully, directly onto the ground also. So today I'm going to be discussing one of the regional rabies control networks called MERACON, and how that helps to deliver a regional approach, but also supporting those national governments in the implementation of their national strategies. So what we're going to start off with, just what is MERACON? So I think we've had a good introduction about rabies, about the disease, and obviously about its prevention. So we're going to move directly into the regional networks themselves. So if we look at MERACON, or the Middle East, Eastern Europe, Central Asia, and North Africa Rabies Control Networks, and now I think we understand why we stick with the acronym MERACON. So this is a regional network that is dedicated to rabies control and elimination, and is under the Secretariat of the Global Alliance for Rabies Control, but is very much driven by the national governments and the national focal persons working towards rabies elimination in each of the participating countries. This network continues on from the successes of the former MEREB network. So this was a former slightly smaller network that was then formed into the more overarching MERACON network, that then aligns with some of the other regional rabies control networks that are present throughout the world, including the Pan-African Rabies Control Network and the Asian Rabies Control Network, so the PARACON and ARACON networks. So importantly, all of these networks align directly with the global strategic plan, or that global strategic plan for the elimination of dog-mediated human rabies by the year 2030. If we look at the MERACON network itself, these are some of the participating countries. Of course, all of these rabies control networks are open to any interested participating countries. And the idea is to really group different countries within particular regions that may share similar experiences in terms of their rabies control and elimination efforts. So we're going to look very quickly at how MERACON fits within the global strategic plan. So looking very much from that international level and how that fits in. And then I'll lead on to how that then ties in with the national strategic plan that we heard from Philip as an example. And then, of course, into the implementation as we see on the ground as from Andy's presentation. So looking at the 0x30, or the global strategic plan, there are three core aspects about this plan. The first is that it is a country-centric approach for sustainable implementation. And I think this is absolutely critical, is that the countries lead the implementation and of their national strategic plans. They take ownership and they implement this particular plans, of course, with that support from the global community. And I think, again, we've seen this perfectly in the previous two presentations, where we've seen the countries really taking lead, taking ownership of those strategies, but then of course being supported by the international partners and international community. And this is very much the crux of the 0 by 30 Global Strategic Plan. As we've seen, and again highlighted by Andy, that this is supported by the United Against Rabies Forum. And in essence, what the United Against Rabies Forum is that it is a global rabies forum that brings together all the different experts from around the world to share their experiences and knowledge, to develop new tools, and to support the national strategic plan and their implementation from that international global level. And these tools, the resources, the guidance, the lessons learned, and the information that's shared through the United Against Rabies Forum, and of course that's outlined within the 0 by 30 Global Strategic Plan, provides that guidance for the development and implementation of effective national strategies. And I think that word effective is absolutely key. As we've seen for many years in the past, that many national strategies have been developed over the years, but unfortunately, without the clear guidance and without very specific objectives and clear support, these national strategies are in fact difficult to implement, and often are simply left to sit without being implemented themselves. And I think that is the difference now that we're seeing in the recent years since the development of the Global Strategic Plan and the support from the United Against Rabies Forum and the partners that are involved in that, is that we are seeing feasible, effective national strategies that are being developed and that can then be implemented. So if we can look at the 0 by 30 Global Strategic Plan as this sort of pyramid, as we see on the right, we can see right at the base is that the countries form the foundation of this. They form the foundation of the vision of achieving 0 human deaths from dog-mediated rabies by 2030. And that is why the country-centric approach is so essential for sustainable implementation. We can then see at the midpoint of this pyramid the link between the Sustainable Development Goals, the various different partners that are involved, and the link between the countries is that United Against Rabies Forum, who then provides the coordination, the catalytic response, but very much in support of the country-centric approach. And then what we see in between this are the national and regional elimination plans. And this is where the regional networks and those strategies are that creates that link between the countries and this international forum of experts that provide the support. So if we look at MERACON and the Global Strategic Plan, again, both are very much centered on this country-centric approach. And I know I've repeated that several times, but that is something that is absolutely critical to driving successful rabies elimination. The network then provides a means to share knowledge and those lessons learned. So that is knowledge and lessons that are coming from the international, the global level and filtering down. So knowledge and lessons that are coming from different communities, different countries that may be experiencing similar challenges, but also knowledge within the network and within those participating countries within the network. The network also provides the capacity to provide training and a means to disseminate the latest tools, technologies, and strategies. And again, this would include the training and the latest tools and strategies that are coming from the international level. And I think this is where the United Against Rabies Forum plays such an essential role in terms of developing these different resources, bringing these different tools together, and bringing and developing these national strategic plan templates, as an example, to then filter down to the countries. And that's where the regional networks, such as MERACON, play such an important role, is that conduit to bring things down from that international level and filter it directly to those focal persons at the national level who are in control and who are driving those rabies elimination plans within each of their different countries. And again, absolutely key, and we heard it from Andy again, is to support and enhance that collaboration. So working locally, nationally, and also at the regional and international levels. So importantly, what we found through the coordination of these networks is that the collaboration aspect is critical, not only between different countries, but sometimes surprisingly is even within the country itself. In many cases, bringing focal persons to these regional network workshops and working meetings, we find that a participant or a focal person from the human health sector may meet their counterparts from the animal health sector for the first time at one of these workshops or working meetings. And we've seen that, and we know and understand that One Health is absolutely essential towards driving rabies elimination. And yet, these different focal persons are not necessarily in contact with one another. And that's, again, the absolute importance of these regional rabies control networks. So looking at it holistically, it's the regional rabies control networks, such as MERACON, are a means to share ideas and knowledge and to develop a shared vision. And I think that is key to then align these governments and these countries to the global strategic plan and the tools and resources that are available through the United Against Rabies Forum. So as I've briefly mentioned, we see that the MERACON network unites countries in a particular region that face these similar challenges. And it really brings people together to share these different ideas, and novel ways to drive rabies elimination in an effective and strategic manner. It also facilitates regional cooperation and collaboration as well as networking. And I think we've seen that in terms of rabies being a transboundary disease. So just because humans have created these country borders, it doesn't necessarily mean that the dogs will abide by those particular borders. And we know that rabies is a transboundary disease. And this means that we need to collaborate on a transboundary level. So looking across governments, across countries, across states, and across regions as a whole. So the network also then provides training and a means to disseminate the latest tools, technologies, and strategies. And we can then see this in various different ways. So again, these aspects have been highlighted in the previous two presentations. And we've seen in terms of the development of national strategic plans and the guidance within the development of national strategies, the use of the national strategic plan templates coming from the United Against Rabies Forum, and all of these are offered through the Regional Rabies Control Network to develop those national strategic plans, or at least to support the development of those strategic plans. It also offers support in terms of surveillance tools, education and training, and awareness and advocacy. Again, all the things that have been mentioned in the previous presentations and have highlighted, these all filter down through the regional rabies control networks also. So if we look at developing and revising the national strategies in a little bit more detail, so one of the core aspects of the regional rabies control networks and the processes that these follow in terms of the development and revision of national strategies are the SARE workshops, or the stepwise approach towards rabies elimination workshops. So these workshops will help national governments, even at a sub-national level. These workshops can be undertaken to develop or revise the national strategy. But also, importantly, is that we don't just develop a document that provides very general and broad objectives that are, may not have a direct plan of intervention, but alongside that, these workshops also help to develop a medium-term work plan. So again, allocating particular tasks and resources to particular stakeholders within the country so that they can drive particular activities and take ownership of those activities so that we can see progress in the different aspects that are important to rabies control and elimination. Importantly, these workshops also aid in demonstrating progress. So it's not just about evaluating the situation, but because there is a continual evaluation, you can then demonstrate the progress by seeing different activities being accomplished over time. Your score within this framework can then improve. And this is absolutely important for advocacy, for highlighting the successes that have been shown within the different countries. We see that these workshops are certainly a means to engage in a One Health manner. And these networks provide that support. So bringing together the different stakeholders from different sectors. As I mentioned, these are often the first instances where national focal persons from different sectors come together and actually meet with one another. And something as simple as exchanging email addresses or exchanging telephone numbers makes a huge difference in terms of initiating that One Health engagement. So this then helps to improve the coordination between human and animal health. Again, something that is so critical to driving rabies elimination, and also then promotes the One Health focused tools and approaches within the global community that are available. So if we look at these workshops and these regional network meetings from a surveillance point of view, MERACON itself, but all the other regional rabies control networks provide surveillance tools, guidance, and technical support on One Health rabies surveillance systems, both at the national as well as at the regional level. And again, all of these systems, all of the surveillance information tying into those needs outlined through the United Against Rabies Forum, through the WHO Global Health Observatory, and through the WOA WAHIS platform in terms of your international reporting requirements. So the tools then help to align what the national governments require in terms of their international reporting obligations, but of course, also in terms of the absolutely essential data that is required so that we can track and measure impact and progress. These tools and the guidance and support applies to all the different aspects of rabies surveillance, including integrated bite case management. Again, we heard about this from Andy's presentation, vaccination tracking, and bite case tracking, among the other aspects of rabies surveillance that need to be implemented. Looking at education and training, so these networks try to encompass all the different key aspects of rabies control and elimination. And again, we see that in the form of education and training, providing education materials through certified rabies courses, as well as then training in terms of dog population management strategies, training in terms of mass dog vaccination, in terms of planning campaigns, implementing them, training animal handlers, and those various different aspects. And then again, in terms of training in terms of surveillance and data reporting needs and requirements. So in conclusion, the MERACON network, as well as all the other regional rabies control networks, support and reinforce national rabies elimination initiatives. They act as the conduit from the international level down to the national level and help to drive a One Health focused activities and support. They also help to create a regional approach to controlling rabies through the standardization of practice, and because of that standardization is that a regional plan and approach can be then developed far more easily and far more effectively to, in particular, address that transboundary nature of the disease. And then, as I've mentioned, sharing that knowledge, the tools, the training, the ideas, and creating that shared vision to achieve the goal of
siap.
0 by 30.
Makasih ya, Mas. Suwun yo.
So I'd like to thank you very much for your attention. And just as a reminder, I would like to again thank the coordinators of this webinar for hosting this as a World Rabies Day event. I'd like to remind everyone in participation about World Rabies Day this year. And I think very aptly, the theme this year is Rabies, One Health, Zero Deaths. So again, aligning that One Health vision and reminding us of that goal of 0 by 30. So you can learn more about World Rabies Day and also get involved. Anything can be registered as an event on or around World Rabies Day. So please, you can either scan the QR code on the right or go to the website to find out more about World Rabies Day and join in the global efforts to celebrate and drive rabies elimination. Thank you very much.
Thank you, Terence, for that excellent overview from the importance of regional networks. And I'm hoping that you'll be able to scan in this event for us as one of those. I have a question in regards to your experience and in particular regionally with the SARE process. Do you have a sense of, for a country that is just starting out with a national plan, what's that timeline look like from origination up to realization of elimination? Could you give us some sense of timing? Are you on mute, I wonder? I'm sorry, I can't.
Apologies, sorry. In terms of the SARE process, the actual process itself takes about 5 days of an intense workshop to develop this plan and the work plan that goes along with that. And then it's very much in terms of the country's capacity to drive that. So it is estimated through various different tools that are available that from absolutely no data, no information about rabies to elimination of dog rabies entirely. So not even the 0 by 30 goal, but beyond that can be achieved in 13 years or fewer. So it is possible to do that. But again, as we've seen with the different examples, that is entirely up to the country's capacity and the identification and the implementation of this work, especially being driven through particular champions within those countries. And that's something that's absolutely key, is to have those champions who are driving it on the ground and making sure that these different tools and resources are being used adequately.